Hi, my name is Natasha Uilkie, and this is my HEENT exam. I have a lovely patient here, Nova Lee. Can you please tell me your full name and date of birth?
Nova Szymanski, February 3rd, 2014.
Perfect. Just checking your wristband here. Perfect. That is you. I'm going to do some hand hygiene. Okay. So I'm starting off with a visual inspection of the head. Just looking at the shape and the contour of her skull, also looking at her hair distribution, which looks normal. We'll next move to palpation. Palpating the skull, checking for the shape, contour, any masses, bulging, or depressions, which there are none. Next, I'm going to inspect the face, looking for any involuntary facial movements, scarring, or lesions. Also checking for symmetry here. Looks good. Next, I will palpate the temporal pulse and the temporomandibular joint. So go ahead and open your mouth and close. Good. So I didn't feel any clicking. There wasn't any popping sounds. And was there any pain? Good. Alrighty. I will next palpate the sinuses. I start off with maxillary and frontal. Any pain or pressure? Nope. Good. Alrighty. All right, next we'll grab my pen light. And I am moving on to the eyes. Looking at the sclera, making sure it's nice and white. There's no yellow or jaundice in the eyes. I'm going to pull down on the lower lid and inspect the conjunctiva, which is nice and pink. Good. All right. I'm going to just use my light to inspect the eye further, making sure there's no foreign bodies. I'll next test the pupillary response. So let's see, scanning back here, I'm going to shine light in each eye, looking at the pupil. Good. Again. Okay, good. The pupils are equal, round, and reactive to light, and they're also symmetrical. Next, I'll move on to the visual fields. I'm going to be testing your peripheral vision. So just look straight at me and tell me when you see my hands. Good. Now I'm going to move anterior and posterior. Good. That is all intact. Next, I will do the blink reflex. So just look straight ahead. And that tests the trigeminal and facial nerve, which seems to be intact. Next, I'll move on to the fundoscopic exam. So I have my ophthalmoscope here. I'm going to have you look straight ahead. I'm testing for the red reflex here, so I'm going to make sure I use right eye to right eye and left eye to left eye. So I'm going to start off standing back and move inward. So I'm going to be coming quite close to you, okay? So right eye and your right eye. So look straight ahead, see positive red reflex, moving inwards, see following the blood vessels to find the optic disc. Good. And get on the other side, look straight ahead. Okay. There's the red reflex, moving in, and following the blood vessels, see the optic disc. Good. Thank you. Alrighty. Next, I'll move on to the ears. Always starting off with a visual inspection, looking for their symmetry and placement. Looking at the external canal for any drainage, or redness, or obvious irritation, which I don't see any of. I'll next test the acoustic nerve. So I'm just going to include the trays here and whisper a word, and you tell me what you hear. Good. And here. Good. The acoustic nerve is intact. I will then perform the tug test before I use my otoscope, just in the case that there is an infection and then there is tenderness that can make that part of the exam very uncomfortable. So just kind of tugging on the auricle here And I didn't elicit any response. Do you have any pain when I do that? And on the other side. Anything? Good. All right, I'll then grab my otoscope. Place a large speculum onto it. So since I have a pediatric patient, I will pull the pinna back and then upwards. In an adult patient, I would be pulling the pinna back and then up. Okay, so up and back. And I am visualizing the internal ear canal and my CBT panic membrane is nice, curly, and white, and there's no bulging. Other side, just a slight bit up. So up and back, and I can visualize the tympanic membrane is curly and white, and there's no bulging. All right. So that includes the ear exam. I'll then move on to the nose. Always starting off by visual inspection, looking for any obvious deformities or change in the shape. No drainage or crusting or skin changes there. I'm going to tip your head back, and I'm going to use my pen light to visualize the turbinates in the nares. Mucosa is nice and red. I don't see any polyps. Good. All right, and I was negative. That exam was negative for any septal deviations. Next, I'm going to move on to the mouth and start off with my visual inspection of the lips, the area surrounding, looking for any cracking, lesions, or sores, which there are none. I'm going to have you stick out your tongue. Good. So tip your head back and say ah for me. Good. So visualizing the mucosa, her dentition, and her tonsils. The uvula is midline, and she has good dentition. Next, I'm going to palpate all of the lymph nodes in the neck area. So I start off with a visual inspection of the trachea, looking at its midline, and there's no torticollis. I'm going to start off using just the pads of my fingers and kind of going in a circular motion, palpating pre-auricular, post-auricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, subclavicular here, supraclavicular here, and subclavicular. So the lymph nodes should be pea-sized. They should not be hard. They are mobile, and it can be uncomfortable, but there shouldn't be any pain. Did you have any tenderness in those areas?
No.
Okay. The last part of the neck exam is the palpation of the trachea. So I will come behind my patient here, and my two hands right on the trachea here. I can feel the cricoid process and the isthmus, and I want to palpate the thyroid here. So my hands are below the isthmus. Let's go ahead and swallow for a minute. Swallow your spit. Okay, one more time. Good. So when she swallows, the isthmus comes up, and I can palpate the thyroid. Can you feel for any nodules or tenderness? Any tenderness there?
Yeah.
Good. All right. And that includes my head, eyes, ears, and neck exam.